All right, friends, if you care about women and you care about the unborn, you need to buckle your seatbelts and listen up because we have a very important show for you. Those of you who watch my show know that I try to not overstate things as often happens in our discussion today. But it's not exaggeration to say that our guest today, Dr. Donna Harrison, what she shared with me earlier on a podcast interview just surprised me and stunned me. And I couldn't believe I hadn't heard some of the effects of over-the-counter abortion before. So instantly after I interviewed her, I said, you've got to come on to my show if you'd be willing to talk about this. I'd love to use the platform that God has given me to get the word out. So our guest today, Dr. Donna Harrison, is the CEO of the American Association of Pro-Life Obstetricians and Gynecologists, which is the largest non-sectarian pro-life physician organization in the world, with over 7,000 members worldwide. Dr. Don Harrison, thanks so much for coming on the show and talking about this sensitive yet really important topic.
Thanks for having me, Sean.
Yeah, well, we're going to get into over-the-counter abortion. And again, what you shared totally surprised me. But let's just one personal question for you. You're a medical doctor and have practiced for years. Why are you pro-life? Was there an experience or an insight that as a doctor convinced you to be pro-life?
Well, there's two things. When I was an undergrad, well, actually in high school, I was pro choice. But when I was an undergrad, I took a biology class, and it was blatantly clear that when the sperm and egg membrane fusion happens, you've got a new organism. And so if you have a new human being, then that human being joins the family of human beings, and we should treat all human beings with respect. The second thing that happened is I had a patient who was considering abortion. And at that time, although I encouraged her that we would provide her with help, she chose to go ahead and have that abortion and came back in my office 2 weeks later and said, Dr. Harrison, I really wish you had tried harder to talk me out of it. It was the worst
Wow.
thing that ever happened to me. And I realized at that time I was not equipped to tell her about the long term effects of abortion. And I said to myself, that will never happen again. So I dug into the issue. And the more I found, the worse it became, to understand what abortion actually does to women. It really hurts women.
Thanks for sharing that with your candor. I can imagine that's even a painful memory, but one you've learned from, and you've made a huge difference for the pro-life cause. Now, pro-lifers are sometimes written off for not caring about women. And frankly, sometimes pro-lifers, we could do a better job of caring for women. But this issue of over-the-counter abortion is one that you say is nonpartisan, and everybody, pro-life, pro-choice, should care about this topic. Why?
Because women are going to be harmed. They have been harmed, even under the circumstances where chemical abortion is available now. Women have suffered from hemorrhage, infections that have killed them, serious, overwhelming
Hmm.
infections. In fact, the first 4 women that died were in California. That was right after the abortion drug was approved. And tissue left inside. None of these things are being told to women. And women also aren't being told that the further along they are in the pregnancy, the higher the risk of these complications. And when we talk about the hemorrhage, the bleeding that happens, we're talking massive hemorrhage. I reviewed the records of one woman that was transfused 10 units of blood. That is the kind of hemorrhage that you see with major motor vehicle accidents. So this is not a benign drug. This is not a pop a pill and poof, the pregnancy's over. This is a drug that has a lot of serious effects. And whether you're pro choice or pro life, we should all be for informed consent. And women are not being told.
Okay, it seems like there's a couple names for this: drug-induced abortion, over-the-counter abortion. What exactly is this, and can it be given without a
Okay.
physician's prescription?
Yes. Okay. So the way this drug was first approved by the FDA in the United States back in 2000 was as a combination of 2 drugs. The first drug is mifeprex. The second drug is misoprostol or Cytotec. It was approved as a combination, but under very strict circumstances. The woman was not supposed to be beyond 7 weeks pregnant, and that means 3 weeks after she misses her period. So that's the way it was FDA approved. And it was FDA approved under a special approval for drugs that are so dangerous that they can't be used without special, what they call post-marketing restrictions. So the FDA knew at the beginning this is a dangerous drug. But immediately the abortion industry threw off any constraint of restriction, and they used the drug up to 9 weeks pregnancy. And they didn't really care what the FDA said or what restrictions the FDA had put on it. They used it however they wanted. That resulted in a number of women dying from an overwhelming infection. And at that point, the FDA or the Planned Parenthood decided, well, we'll just change our protocol. Okay, experimenting on women. It's very doubtful that any of those women knew that they were having an experimental protocol, but Planned Parenthood did it anyway. And they were able, in some ways, to get down the rate of infection, but it's still, women are still dying from this overwhelming infection. Now, the FDA also said that the abortion industry would have to report all the complications that came after the use of this drug. And there's a special reporting system. And that reporting system was in place until 2016, the Obama administration. And one of the things the Obama administration did during that time was, with very little scientific evidence, they extended the use of the drug to 10 weeks pregnancy, which is about 6 weeks after you miss your period. And they said, you don't have to report any complications to the abortion industry. So all that you have to report is death, which means that as of 2016, we lost the ability to track any complications from those drugs. Why is that important? A team of physicians, myself included, reviewed all of the adverse events, that is the complications that have happened, that were submitted to the FDA. And what we found is that maybe only 1.5% of the actual complications from this drug ever got reported to the FDA. But in that, the further along in pregnancy, the higher the complications. And what we found some very surprising things. We found that there were a lot of life-threatening infections, including hemorrhage, that if the woman had not had prompt access to medical care, she would have died.
Okay.
In fact, we found, hundreds of these. And that, remember, this is less than 2% of the actual complications that are happening. So women are at risk, and no one's tracking this. Now, to make matters worse, the only thing that keeps women right now, where there's any safeguard for a woman, is something called the REMS, Risk Evaluation Mitigation Strategy. The REMS is a restriction that the FDA put on the use of the drug and has kept on the use of the drug until now. Okay. So the abortion industry used COVID as an excuse to say, oh, we can't see these women in person. We have to be able to dispense Mifeprex over the internet. So a judge in Maryland, who has no scientific training whatsoever, decided that he would suspend the REMS for the duration of the COVID epidemic. And so that was back about a year ago.
Wow.
So the REMS have been suspended. So the FDA right now is reviewing whether or not they're going to continue having a REMS for Mifeprex. Why is that important? The REMS is the only thing that keeps Mifeprex from being available in a pharmacy. See, right now, theoretically, you have to at least have a visit with a doctor. And why do I say theoretically? There's over 50 websites where you can just simply go online and order Mifeprex. And some of them offer a bulk discount. Now, who would use a bulk discount for an abortion drug except abusers and pimps? I mean, it's horrendous how little we care about the health of women allowing this drug to be used in a willy-nilly fashion without even knowing how far along the woman is, without knowing whether or not her pregnancy is in the uterus, in her womb, or in her tubes. Why is that important? Well, if the pregnancy is in her tubes and she takes Mifeprex, that pregnancy will continue to grow and rupture, and she'll experience pain and bleeding. And that's exactly what a Mifeprex abortion causes, is pain and bleeding. So when she calls with this pain and bleeding, and her tubal pregnancy, her ectopic pregnancy is rupturing, she'll be told, oh, that's a normal part of the procedure. And some of the deaths in women in this country have been because they bled to death internally because their ectopic pregnancy ruptured and they couldn't get to the hospital fast enough because nobody looked to see whether or not their pregnancy was in the uterus first. See, that's the responsibility of a physician, is to make sure they know where the pregnancy is before they give Mifeprex. But when you use it without any physician oversight, or all you're doing is talking to a physician over the internet, there is no way that physician can tell whether or not you have an ectopic pregnancy. There's no way. Now, even worse than that, there's a blood condition where women have what's called Rh negative blood. Back in the early part of the 19th century, before 1950,
Okay.
women who had this problem with Rh negative blood would have one baby and then lose all the rest because their body would mount an immune response. It's called Rh incompatibility. But in the 1960s, we discovered a simple way to prevent that. It's called RhoGAM. So OBGYNs know that every pregnancy and every abortion in a woman who is Rh negative, she should have a shot of RhoGAM. But if a woman is just talking over the internet with somebody, then she doesn't have a blood test. And if she doesn't know she's Rh negative, she has just sensitized herself so that she will lose her next pregnancies. I mean, these are serious medical issues. There's reasons why you see your OB-GYN. There's scientific reasons. There's problems we can prevent. And all of this is being thrown out the window, bowing at the knees of the abortion industry. And that's what APLOG is concerned about. Women are being abused by the abortion industry. They're not being given informed consent. Their fertility is not being protected, and they're not being told what the complications are.
Now, sorry.
No, go ahead.
So, Dr. Harrison, you are pro-life, and you, in principle, would be against something like the over-the-counter abortion drug. But what you're saying is, even though it's legal now, the problem is the way it's being dispensed. This is another higher level problem that pro-lifers and pro-choicers should care about. The ethics of abortion itself aside, just the way this is being dispensed is leading to harm and abuse of women. Is that a fair distinction you would make?
Absolutely. And even if you are pro-choice, a chemical abortion without any medical supervision is a lousy way to do an abortion and opens a woman to unnecessary risks. If you look at the studies, women who have chemical abortions are 4 times as likely to have a complication than women who have a surgical abortion. And the further in pregnancy, the higher the risk. So when you get past 10 weeks and you enter, 13, 14 weeks, 1 out of 3 women, 30% of women, end up having to have surgery to remove the tissue to stop the hemorrhage. And women who are getting this drug over the internet are not going to know exactly how far along they are. There have been many, many studies over decades that have shown that women tend to be wrong about their due date about half the time. So if a woman thinks she's only 2 months pregnant and she's 4 months pregnant, she is now in a risk group where she has a 1 out of 3 chance of major hemorrhage. I'm not talking a little bit of bleeding. I'm talking about losing liters of blood quickly. How will she know? And if she doesn't have prompt access to medical care, she can die.
There were a few comments of people saying she's dropping a lot of stats. Are these made up? What's the proof? And I want to say one thing before you tell us how to document them is for those watching, Dr. Harrison and I were chatting beforehand, and she testifies regularly in court cases about this and has to get her facts right or it will undermine her whole case. So she has been very careful to document these. Now, those watching who want the documentation, where can they find a lot of the studies you're referring to?
Okay, so the best place to go is our website first. It's just aaplog.org. So that's American Association of Pro-Life OBGYNs.org, AAPLOG. And if you go to resources, practice bulletins, and look under, we have many practice bulletins, but look under the ones on medication abortion, we have a fully referenced practice bulletin on this. And if you want more, I am happy to send you our library. We, copyright issues, I can't, right. But I can certainly give you the list of titles. But all of them are actually in the practice bulletin about medication abortion. So I'd encourage you to go check it out.
Excellent. Now, without losing those of us who are not medical doctors trained in this field, how does a drug-induced abortion actually work? What does it do to a woman's body?
Yeah. So a woman's body, when she becomes pregnant, makes a hormone called progesterone. Progesterone means literally for pregnancy hormone. That's what progesterone means. So progesterone causes her body to be able to change inside the lining, inside her womb, in order to be able to feed the baby. But progesterone also causes changes in her brain and in her breast and in her adrenal gland and in her immune system. So progesterone changes a woman's body all over her body. It's not just in her womb. Mifeprex, the first drug of the abortion combination, blocks progesterone. It blocks those changes. So when her body has started to make those changes, and she's feeding the baby, the Mifeprex will then block her ability to feed the baby. It does a bunch of other things, but it primarily does that. And so that will starve the baby. It also makes her uterus more sensitive to contract. And that is where the second drug comes in. Because even though Mifeprex kills the baby, it doesn't cause the womb to push the baby out. So the second drug, misoprostol, Cytotec, causes the uterus to contract and squeeze the baby out. And this has a couple different implications. One, if a woman has taken Mifeprex and she changes her mind, which happens quite a bit, which we have documentation in our review of the adverse event reports. If she takes Mifeprex and changes her mind, and she gets progesterone within 72 hours of taking the Mifeprex, she can increase the chances that her baby will survive up to about 68%. Without it, it's about 25% chance the baby would survive. But she can increase that to about 68%. Now, it's not 100%, but for women who really regret taking that first drug, it's a second chance at life for their child. And that's important information for every woman to know. She does have a second chance. Once she's taken the misoprostol, there's nothing that can reverse the misoprostol.
Wow. Wow. How often when a woman takes this and it leads to the forced abortion or forced birth, I guess you could say, how often is it required that there be a physician to follow up and help with this? And how do we know a lot of these physicians are even trained to deal with this?
Well, let me answer that. Theoretically, when the drug was first approved, the woman was supposed to see a physician,
Okay.
and she was supposed to see a physician after she had taken the first drug, the mifeprex. She was supposed to see a physician before she took the misoprostol to even know if she needed to take the misoprostol, because about 5% of women, 1 out of 20, will pass the baby just with the mifeprex. Okay. And then she was supposed to come back 2 weeks later to make sure that the pregnancy was completely passed. Well, with the changes in first of all, the abortion industry completely ignored that. But with the changes at 2016, the FDA, the Obama FDA said, you don't need to come back anymore. You can just do the follow-up as you want to do it. And with the federal judge in Maryland in 2019, 2020, the the judge said, we're suspending any requirements. Basically, we're suspending the in-person visit requirements of the REMS. And so that means that when a woman doesn't have somebody checking up on her, she can end up with tissue left inside. And the further along she is in pregnancy, the more likely she is to have tissue left inside. Women bleed for months with this. And the problem with having tissue left inside is it's dead tissue, so it gets infected, just like dead tissue does anyplace else. So that will reduce her chances of having children further when she gets a pelvic infection.
Okay, let's get really clear how people get this drug today. Is it through the internet? Is Planned Parenthood dispensing it? Can you get it at a pharmacy today? How exactly are people getting the over-counter abortion pill?
Okay, so you can't get it at a pharmacy right now.
Okay.
But the FDA is poised to remove the restrictions. They're reviewing them right now, and they will probably remove those restrictions in November. If those restrictions are removed, then there's no barrier, there's no legal barrier to providing mifeprex in a pharmacy. But right now, the way women get them over the counter without seeing a physician is there are about 50 different websites that sell the drug over the counter. There was one study of these over-the-counter sales where they ordered the researchers ordered a bunch of pills, and they found that about half of them had less than the amount of drug that they were supposed to have. Packets were broken open. So this is a miserable way. This would never pass official FDA regulations, but it's all black market. The other way that women get it is Planned Parenthood has a telemedicine system where you call in, you talk to somebody via a computer, and they don't do an ultrasound, they don't do a physical exam, they call it no touch, and then they mail you the drugs. What's the problem with that? Well, I told you about the ectopic pregnancy issue and about the blood incompatibility issue. But even then, think about it. What's the mail like right now? You're even 2 weeks later than you thought you were. 2 weeks can change an abortion that might be 95% effective to an abortion that would be 85% effective, or less than that. So again, once you pass from 10 to 13 weeks, which is only a 3-week difference, you've gone from a risk of at least 1 in 10 having a complication to a risk of 1 in 3. This is a terrible way to do an abortion.
Okay, so let me ask you somewhat the elephant in the room. Then why on earth would the FDA consider approving this if it has all the known effects and concerns that you've mentioned that can be documented? Why would the FDA in November be likely to approve even more accessibility to this drug without a physician?
Well, you have to understand that the FDA is underneath the Department of Health and Human Services. And the Department of Health and Human Services is underneath whatever administration is in power at the time. I wish I could say that the FDA were an objective scientific organization, but that's not how they have been behaving with Mifeprex.
Wow. That I think that's important for people to hear. There's probably an assumption about the FDA putting patients first, and this is one reason amongst others to question that and to say that politics probably play a part as well. Now, you make a really powerful statement. In last time we interviewed you, you said what's going on with over-the-counter abortion would constitute malpractice. That's your word, malpractice, in any other
Yes.
discipline besides gynecology. Now, number one, justify that and then tell us what you mean.
Okay. In medicine, a physician is expected to do a couple of things. They're expected to make a diagnosis before they implement treatment, and they are expected to give informed consent. When you give Mifeprex without knowing where the baby is, whether it's in the tube or in the womb, without knowing whether or not the baby's even alive or not, before you give the Mifeprex, because there's a different management, and without telling women exactly what the risks are, that is malpractice. And if you have a bad outcome, then that, if it were any other area of gynecology, you might as well write the check, because that's malpractice. You must give informed consent. You must make a diagnosis. You must tell the woman her risks.
Hmm.
And that's not happening with chemical abortion, especially chemical abortion that's being dispensed via telemedicine.
Hmm. Now, there's a comment here that says you cannot get abortifacient medications over the counter. Your thoughts?
Correct. You can't, they're not dispensed in a pharmacy yet, but you can go on the internet and you can buy them on the black market. There's 50 some websites, and that is a de facto over the counter. Okay, because over the counter means without a prescription. So
Gotcha.
de facto, because it's available on the internet, it is a de facto over the counter.
That's a very helpful clarification. Now, I want to know why more people aren't talking about this. When we interviewed you, I was stunned. I was like, why haven't I heard this? I've written on pro-life, I follow pro-life, have done shows on this channel on pro-life. And what you shared, I thought, I can't believe this is happening in America. Like, it surprised me. Why do you think more people aren't talking about this?
I don't know. Maybe they don't know about it. Things are moving pretty fast with the changes in the administration. That maybe that people just haven't caught up with it. But we've been battling this issue with the FDA since the approval of Mifeprex back in 2000. So we've been following it carefully, and it is remarkable how little attention is being given, real attention to women's health, to real women's health. To allow a drug on the market that is basically experimental at the gestational ages where it's being used and not track the complications, there's no excuse for that.
I've just got to emphasize to those who are watching, there's some debate in the comments, which is expected on a topic like this, that you're pro-life. You're not pushing back right now on the ethics of abortion. That's not your point. You have moral issues and medical issues with voluntary abortion. The point here is the way abortion is practiced, with abortion on demand, its accessibility without a doctor is leading to a ton of harm to women, and they're not being informed about this. In fact, many are being misinformed. That's what you're calling on. So anybody listening to this, if you really care, not just about the unborn, but about women, it should be a pause, and you should care about how this drug is dispensed legally. And safely. That's an area of common ground you are trying to find with pro-choicers. Is that fair? Did I represent where you're coming from on this particular issue fairly?
Yes, I'm an OB-GYN. I care about women. That's why I went into OB-GYN. And what I see is women suffering the brunt of this marketing by the abortion industry. It's very lucrative for the abortion industry because they don't have to pay for real medical care. They can just simply push the pills and kick these women to the side when they have complications. One of the things that we found in our study of the adverse event reports that were reported to the FDA, and remember that only represents about 2% of the actual complications that women are experiencing. One of the things that we found is that the abortion provider doesn't handle the complications almost half the time. These women are just simply sent to the ER. And it may be because you have uh, uh, abortion providers that don't know how to do a D&C or don't know how to handle the complications. It's not clear why. But what is clear is where these women are being treated, and they're being kicked to the ER, and they're being told, lie to the doctor there, tell them you're having a miscarriage, which is a concern because the complications that you see, the hemorrhage that you see with chemical abortion is different than the hemorrhage that you see with miscarriage. Because the abortion drug Mifeprex, one of the effects is that it keeps the uterus from clamping down, from squeezing down to cut off the blood. And it causes it causes the inside lining to continue to bleed. And so when you lie about whether or not you've had Mifeprex, you handicap the doctor from being able to treat you appropriately.
And those of you
So yes,
watching
I
it,
care about women.
those of you watching, we're going to come to your questions. So think through your questions, exactly what you would like to ask Dr. Donna Harrison about drug-induced abortion, and she will respond. She said she's happy to take your questions. So line those up. We're going to come back to this at the end. I've seen a couple comments that about Christians in the Bible, and you'll notice we have not mentioned faith once, have not mentioned the Bible once. This is not a conversation about God. This is about science and what kind of malpractice is happening within larger medical field relating to drug-induced abortions, and how anybody pro-life or pro-choice should think about responding in light of the effects on women. Now, one of the things you said that I guess it doesn't surprise me when I think about it, but I had never thought about before, is that most OBGYNs will not perform abortions. So what are the stats, and why wouldn't they if we're told that it's just another medical procedure?
Okay. Well, there's been 3 studies over the past 15 years. One of them by a pro-abortionist showed that 75% of OB-GYNs do not do abortions. Another one study looked by just general researchers found that 85% don't do abortions. And the most recent study showed that 93% of OB-GYNs in private practice do not do abortions.
Wow.
So it's well over half of OB-GYNs don't do abortions. Why? Because at the heart of OB-GYN, we know we have 2 patients. We recognize that that fetus is our patient. So we balance the interests of those 2 patients, and we do what promotes life for both of those patients. That's just an intrinsic part of what an OB-GYN is. So to go in and intentionally kill the patient, that is our fetal patient, that's antithetical to the oath of Hippocrates, the Hippocratic Oath. And so we value the Hippocratic Oath. We have dedicated ourselves to the health and the life of our patients, and that's why OB-GYNs don't do abortions.
So if this drug becomes FDA approved in November 11th, or in November, what exactly will change?
Okay, so it's already FDA approved.
Okay.
It was FDA approved in 2000. It was FDA approved with certain restrictions. Those restrictions became codified as the REMS, but the REMS prevents a drug from being sold in a pharmacy.
Okay, gotcha.
Right now you can't, you theoretically can't get it in a pharmacy. If the REMS are removed, then pharmacies will be able to dispense this drug. And if pharmacies are able to dispense this drug simply with a prescription, there's actually no real barrier to making that drug completely over the counter. The way it is over the counter now is because you can go on the internet and you can order it without a
Okay.
prescription.
Okay. So, do you anticipate if this passes in November, for pharmacies and doctors, there could be a lot of ethical concerns with their practice and potentially being forced to prescribe or dispense this against their moral standards? Does that concern you, what might shift in November?
I don't think doctors will be forced to prescribe it in November. I do think pharmacists are at great risk
Okay.
because there was a case simply about a kind of contraceptive that is actually a second generation RU46. It's called Ella. There was a case in Washington State where a pharmacist said he wasn't going to prescribe morning after pills. And the state said, "You, Mr. Pharmacist, are an agent of the state. You have no professional capability of
Okay.
making that decision." It's a very scary thing. When
Wow.
medical professionals become agents of the state, we've seen this experiment before. Let me name it for you: Stalinist Russia, Maoist China, Soviet Union, Nazi Germany. Okay, we've done this experiment when medical professionals cease to adhere to the Hippocratic Oath and they are forced to do what the state wants. They become the most dangerous person in the state.
Hmm. Now, there's a comment here. I just, maybe we weren't as clear, but it said she lied at the beginning saying the drug was available without prescription. It is available without prescription right now, correct?
Over the internet, there are 50 different websites where you can go and order without a prescription. In fact, there's a TikTok video I came across years ago. I think it was about 2018. Joe Baca, and it's this guy, and he says, "Hey, I just ordered these drugs without
Wow.
ever verifying my age, my
Wow.
sex, my gender, or the state of my pregnancy." And it's an amazing thing that you can get these without ever knowing who's using it. And think of the potential for abuse. I mean, this is the problem. Here's a guy. What is a guy going to do? There's about 4 different lawsuits that I've seen of disgruntled boyfriends who've crushed up the Mephoprex and put it in their girlfriend's smoothie or her ice cream, and she aborts. Okay, lawsuits for suing the guy for this. So it's it's happening now, guys. Just check out lawsuits. Google lawsuits over abortion or forced abortion. You'll see it. It's happening.
Now, there's a comment right here that says, to be fair, if you know how, you can order anything on the internet. So, what makes this different than anything else you can find if you just have the savvy to track it down and get someone to sell it to you?
It hurts women. It hurts women. And it's not a pop a pill and the pregnancy's over. This is a drug that has serious effects on women, including can lead to death. And I think the trivialization of this drug is part of the danger for women. So, where we may disagree about the ethics of abortion, we should all be on the same page
Hmm.
about giving women informed consent and safeguarding their health and knowing the effects of a drug when we give that drug. And right now, that is not happening for the abortion drugs.
Hmm. So, what about California college campuses? Has this been available in the past? Is it available now without a prescription? Will this shift in November? I live in California and I have a son who's going to college next year. Like, these are real issues. I teach high school and I teach college students at a private school. What's the rules in California right now and maybe even beyond?
Well, I don't live in California, but my understanding is that you last year or so passed a law that says these drugs will be available at the campus health centers. So when that drug is dispensed to Jane at the campus health center, and maybe or maybe not, they verified how far along she is in pregnancy. And she goes back to her dorm room and she takes the drug and she's bleeding all over the dorm room and she passes the fetus. Look at the implications of that. I mean, who's going to who's going to be responsible for getting her to medical care? The
Hmm.
campus health center isn't open at 2 in the morning. What's she going to do? And what if she's by herself, which is very possible? Does she just lay there and bleed to death? Who's going to take responsibility for taking care of these women? This is my concern. It's so short-sighted. It's almost a fantasy that the pro-abortion industry has, that they just give these drugs and walk away and everything's good. It's not good, guys. When you're bleeding and you're cramping and you're passing tissue and you're hemorrhaging, this is not good. You need to be under medical care. And these women are basically abandoned.
So you are concerned with the issue of abortion as a whole, but that aside, is your kind of crusade, might not be the best word here, but your efforts to educate people just so there's correct information given about this, so it's required that it's prescribed by a doctor. What would you like to see happen in terms of this drug, given within the confines and the broader rules of Roe versus Wade within the United States?
I think the minimum that women should expect is excellent health care. And I think part of that excellent health care is informed consent, knowing exactly how far along they are, knowing exactly what their risks are if they choose this kind of an abortion versus another kind of abortion, and that they be under the care of someone who can take care of them when they experience the known complications. And I think that is something that all of us should agree on. Women deserve excellent health care, and they're not getting it right now.
Hmm. In a minute, we're going to come to questions. If you have a serious question for Dr. Harrison that you would like her to weigh into that relates to the topic of over the counter abortion, drug induced abortion, whether it's for or against, she'd be happy to take this and give her thoughts on it. But I've got a couple more for you before we go to questions. So if you want to start listing those questions in right now, we can do our best to tackle those. You maintain, quote, that pornography, sex trafficking, and abortion are inseparable, a triad. What do you mean by pornography, sex trafficking, and abortion going together inseparably?
Okay. We have a whole practice bulletin on that, and I would really encourage you to read it to get the details. But part of the issue with pornography and sex trafficking is that pornography increases the demand for sex trafficking. Pornography itself, the visual exploitation of women, of their bodies, is a kind of sex trafficking. So whether it's a visual, image, or whether it's the actual act, the physical act, you still have an exploitation of women, and oftentimes it's young women. The mesh with abortion comes when you read about the survivors of sex trafficking. Those women that have survived sex trafficking will tell you that they had interaction with medical care, and the most common place they had interaction was Planned Parenthood. Many of these women have had 4, 5, 6, 7 abortions, because abortion is the way that a pimp can manage his or her herd. And so these women become pregnant, and then they're aborted so that they can go back out on the street. I mean, there's some horrific uh, testimony of women who say that they were aborted, even sometimes physically aborted by their pimp, and then told to traffic again that night. I mean, this is a horrendous thing, but abortion becomes an integral part of being able to get the women back on the street. And so you have cases where Planned Parenthood has taken and aborted 13-year-olds, 14-year-olds, never reported them. And when asked why, I was just amazed at this. When the Planned Parenthood worker was asked why she didn't report it, she said, well, I had no reason to believe this 13-year-old was being abused. And the 13-year-old was there for her second or third abortion. I mean, this is by definition sex trafficking. This is by definition
Mm.
abuse. So, so it's a dark underside of the abortion industry that they often do not report statutory, statutory rape. They often do not report underage pregnancy. And this does not serve women, especially does not serve trafficked women. It doesn't help them get out of the situation.
Hmm. Dr. Harrison, we have a guest who joins us somewhat frequently. Dr. Knows asks a question. I'm going to bring it in here. He says, what does the FDA say about your objections? What do other OBGYNs, maybe who are willing to perform this, say? So how would the other side push back? What are some of the responses that you've heard? And maybe your take on some of those responses, Dr. Harrison.
Well, the FDA, we did file a citizen petition with the FDA documenting our concerns. And the FDA took 16 years to respond to that citizen petition. No,
Wow.
14 years. They responded in 2016, the same day that they changed and loosened the restrictions. So, what does the FDA say? Not much.
Wow. Very interesting. Um, wow, that surprises me that they're not responding to this at all. There was one question that was up here that was about the movie Unplanned. I'm not sure if have you seen the movie Unplanned by any chance?
I have.
So
I
there's
have.
the scene where the key actress is given kind of a pill, a drug. I don't understand the medical side of it. She goes home to get rid of the abortion, and she is in cramps and she's bleeding everywhere. When I saw that, I was stunned. I thought, oh my goodness, she must have had an unusual, bad, negative reaction to this. It was very graphic. It stuck with me. I had no idea. Is that the same kind of drug that we're talking about? And is that reaction common for many women?
It is the same drug. It is Mifeprex. She received Mifeprex as the first drug. That is what a Mifeprex abortion looks like, and that's common. In fact, most women need some kind of narcotic pain medication to make it through the abortion.
Oh my goodness. All right, if you have questions, load them in here. Now is your chance. Um, Here we go. Let me bring this one over. Here's a thoughtful question. John M says, I know the unborn surviving a morning after pill is rare, but are there any complications for the mother or child later on in pregnancy or after birth?
Okay, so we have to be clear what we're talking about here. So there are two so-called morning after pills, and those are pills that are taken after intercourse. Sometimes they prevent the egg from being released. Sometimes they prevent the embryo from implanting. Of those two pills, one of them is a kind of an artificial progestin. It's not a progesterone, it's a progestin. The other is a second generation Mifeprex, and it's called Ella or Ulipristal. It's actually equally potent milligram for milligram with Ulipristal. It acts in the same way. Okay? So just clarifying, morning after pill is, those are the two morning after pills. In this interview, we've been talking about Mifeprex, which is an abortion drug. Okay? So if you ask, are there women whose babies survive after taking the first pill, after taking just the Mifeprex? It turns out that the studies show about the most would be about a 1 out of 4 chance of survival. Of those babies that do survive and haven't had progesterone but do survive, there doesn't seem to be any increased risk of birth defects
Okay.
so far. Now, in women who have been given progesterone, it's also been studied women who have taken the first pill, the Mifeprex, and then have been giving abortion pill reversal, abortion pill rescue, which is just progesterone, the natural hormone progesterone. Those women, their babies have been studied, and they also don't have an increase in birth defects over the normal rate of birth defects. So it seems that Mifeprex itself doesn't seem to cause birth defects. The second drug, misoprostol, can cause birth defects. So women who have taken just the misoprostol, which is Cytotec, just the second drug to cause abortions, do have an increased risk of some pretty severe birth defects. And so that's what I can tell you.
Okay, that's a very helpful distinction. What's the response you get from sharing this? Because there's been a few comments of people who are just utterly dismissive, don't listen, write it off. Anything that smacks of pro-life aren't even given an audience. There's some others that are a little bit more skeptical, like, give me the studies, I want to look this up. Then there's others
Okay,
like
good.
myself, aware of your credentials, aware, had seen the PowerPoint, did enough research to pause and go, what is happening, and just be surprised by this and wanting to do what I can to get the word out simply to help women, the abortion issue aside. What kind of responses are you getting as you talk about and you share and you write on this?
Well, there's always people who say, I'm not going to listen to anything. But reality is reality. And when we have compiled the medical literature, when we've looked at the studies, that's what we're talking about here. And I would encourage you, I hope you doubt what I'm saying. I hope you go out and do the research and look at our website and pull all of those papers that we cited and see for yourself, because that's the way you're going to know that what we're saying is actually accurate.
Hmm.
When I discuss with people, which I do all over the country and in multiple different venues, and they're dismissive, I say, well, look, okay, we may not agree on abortion. Let's agree on informed consent. Why don't you show me your research papers that show that this drug has no harms? And I'll show you mine that show that this drug has a lot of harms. Okay? And the fact is, they don't have the research.
Hmm.
And it is what it is. I mean, women are being hurt by this drug. And I'm concerned, and anybody who cares about women should be concerned that this is not this is not good for women.
There's a comment that said, this discussion seems to be about exceptional situations. I want to bring it back. Give us the 30,000 foot view that this is not just a rare case here and there, but is actually a common phenomena in varying degrees, that women are really getting harmed by this, and there's misleading information out there.
Okay. Well, if you look at one of the best studies that has been done, and that is from the it's the stake study, it's the Finnish medical database. Okay. The author is Niinimäki. She's got a whole team of people, and they looked at medical abortion complications versus surgical abortion complications, immediate complications. And what
Okay.
they found was about a 5% complication rate. Okay.
Okay.
Now let's take that. Let's take that. And I'm even underestimating her a little bit. Let's look at the 3.7 million abortions that have been done, multiply it by 5%. We're talking 185,000 women. And this is only immediate complications. This isn't long-term complications. Okay. So 185,000 women, that's a lot of women.
Wow. That's amazing. I'll talk about, if I remember correctly, you said in California alone, was it 20 deaths, or did I miss that number from
Yeah.
last time?
Yeah. So the FDA has reported, I think, about 24 deaths as of
Okay.
2019. There were 4 deaths immediately after, within the first 4 years of the approval of Mifeprex, there were 4 deaths. One of those was Holly Patterson. Her father cared enough about this issue that he started reading, Why Did My Daughter Die? And
Wow.
he saw a newspaper article in Canada about the clinical trials of mifepristone. And he saw one woman who died in a very similar way. He called the FDA. He called the CDC. He said, what's going on here? And it was because of Holly Patterson that we even knew that this rare bacteria called Clostridium sordelii can cause deaths within a couple weeks after a woman has a medical abortion. It was one guy who cared enough to actually question what was going on.
Hmm. Now, there's a comment here that says people are getting these drugs from the internet because states are closing down Planned Parenthood clinics and removing access. But if I understand correctly, these drugs have been dispensed through Planned Parenthood and through the internet. Both are without physician care. So however they get it, it makes no difference, and it's still harming women. Is that correct? Did I understand that
Yeah,
correctly?
however they get the drug, if that woman doesn't know how far along she is, and we don't know what her blood type is, and we don't even know that the pregnancy is in the womb. She could have an ectopic pregnancy that could rupture. It doesn't matter how she got that drug. She's still at risk.
Mm. That's really, really, really helpful. Somebody made a comment that said this is a discussion about drug safety, not right to abortion, and that's correct. That's what we're discussing here. We are both pro-life, and that's where we stand. We have been very clear about that. But whether you're pro-life or pro-choice, it seems to, and it's all said and done, I'll let you make some final comments. We should all care about the health and safety of women. We should all care about people getting any drug, any procedure, that they get accurate, well-informed information, not misinformed. And we should care if there's the kind of health risks that are attached to this, that women have a access to a doctor who will get correct information about the kind of procedure that they had to care for these women. So the abortion issue aside, this drug is being dispensed in an unethical, inaccurate fashion that is leading to the harm of women. Is that a fair summary? Did I say it too strong, not strong enough? Sum it up for us, what the heart of your concern is.
Well, I think you said it. Women are being hurt by this drug. They are not getting informed consent because without knowing how far along a woman is and whether or not the pregnancy is in her womb, you can't tell her what her risks are. They're being given this drug when they have contraindications, like an ectopic pregnancy. That's a contraindication to this drug. So all of these, you're right. It's about drug safety, and it's about an abortion drug, which is a completely elective drug, being used in women, serious harms, without women being told what those harms are. That's the concern.
I really appreciate you speaking up on this. I can only imagine some of the criticism that you get in person, in print, but you've had the courage to speak up because you care about women. Tell us again the website. I believe it's aaplog.org. Is that correct? Tell us how
That's
we can
correct.
follow and
Yep.
get informed with what just you and the organization.
Okay, so you can always join us as an associate member. That's free. And you can get our email updates, which we put out twice a month. We talk about what's going on in the medical literature. We talk about what's going on, pro-life issues in different states. We give you opportunities to network with other OBGYNs who are, and some midwives and a few family practice docs. So we do those things for members, and we would be happy to have you join and follow us. If you want to join us as a dues paying member, we have more benefits for you, including access to some things behind the paywall, which will be helpful for you. But we encourage you to come take a look at our resources, because that's where you will find the information and the lists of studies that you can go check out for yourself.
Well, thanks so much for doing this. We really appreciate you coming on. I appreciate your boldness to speak. I use this channel for a range of issues. Sometimes I have guests I totally disagree with, some partially disagree with for the sake of conversation. But when you and I talked the week before last, I instantly thought my audience who follows this needs to hear this. And even if they are pro-choice, be informed in terms of what's going on, because the health and life of women are at stake. So thank you for speaking up on this. Don't disappear afterwards just so I can say goodbye. But those of you following the channel, pro-life is a topic, even though this is not so much the ethics of abortion in this show. At Biola, I teach. We have a class on ethics. Some of the leading ethicists in the world, people like Scott Ray, who will teach classes on this very topic. And we would love to train you to be an apologist for your church, for your community, to help defend the rights of the unborn. And again, if you watch this, I don't normally say this, but would you consider sharing this with somebody, with a friend, pro-life or pro-choice? I want to use my channel to help Dr. Harrison get their message out. So if you could help get the message out on something so timely with so much at stake, we would appreciate that. Last thing, on Wednesday, we have Michael Bird, one of the leading New Testament scholars in the world, coming on from down under. He'll be a day ahead in the future. He has a new book out on 7 things he wishes Christians would understand about the Bible. And he's funny and he's insightful, one of the most well-known, influential theologians, New Testament scholars today. Make sure you hit subscribe and think about joining us Wednesday at noon. So thanks so much for joining us today. And I really appreciate you coming on, Dr. Harrison.
Thank you for the opportunity.